Hi, my name is Mary Lou Pauly, and I serve as Issaquah's mayor. And today I'm really happy to be joined by some of our folks up at Swedish, Chris Bodwing, the Chief Operating Officer, and Dr. Jennifer Spence, who is a primary care physician at Swedish Issaquah. We're doing our meeting today via video and practicing our physical distancing. And I just want to say it is really nice to see both of you, even if it's just by video, just to give me this opportunity on behalf of our entire community that we are so grateful for all of the work that you did. I know there were some signs up, I know there was some food delivered, but you really need to know how much our community appreciates you. So welcome today.
Thank you. Happy to be here.
Fantastic. Some of the things I'm hearing out in the community is folks are wanting to know, what is Swedish Hospital doing to keep patients and caregivers safe during the COVID-19 pandemic?
It's a good question. We've been working on that for, really since February 28th when we received our first COVID positive patient. So we have a multi-layered approach to make sure that both patients and visitors and caregivers and providers stay safe. And it starts with limiting access to the campus. So we have closed the campus to the public, and we're not allowing anybody just to come onto the campus for any reason at this time. So only folks that are here right now are those working, those who are here to receive care. And then we've even reduced some of our visit policies as well to make sure that we're able to, limit as much as possible the number of people on campus. So that's kind of step one, is just reducing the population here. We've also got all our caregivers and providers who every day are doing self-screening for symptoms, attesting that they're not experiencing any symptoms that might be related to COVID-19. If they are, they're not working. And then to add another layer of security or safety on top of that, everybody gets screened before they enter the hospital facility. So screened for fever, screened for symptoms before they're allowed onto the campus. And if they do have symptoms and they're not here to seek care, then we send them away and ask them to come back. And of course, if they're here to seek care, then we have protocols to get them to a place where they can be treated safely, where they won't infect anybody else. If people do come in with symptoms, of course, we've got protocols to make sure we get them into the parts of the hospital where we're able to handle that, where we're able to isolate them appropriately. And in that regard, at Issaquah, we're actually quite fortunate that it's a relatively new hospital, because our facility is designed with a lot of different isolation rooms all throughout the hospital where we can effectively care for COVID patients and where we don't have to worry about infecting other patients as well. So we spent some time either segregating parts of the hospital for COVID patients or utilizing those isolation spaces as appropriate. And then last thing I would say is everybody that enters the campus is masking, and that includes caregivers and providers at all times throughout the day in all spaces. And then all visitors and when appropriate, patients are being asked to mask as well. So the multi-layered approach has been pretty effective. We've had very few of our caregivers or providers that have contracted COVID-19. So we feel like we've got a pretty good layer of safety in place right now.
Thanks, Chris. That's excellent. How many employees are up at Swedish?
We've got about 1,200 employees in total.
Wow.
That work at Swedish Issaquah. You can count on about 700 to 800 on any given day here. So it's been, quite a logistics challenge to implement all this, but 3 months in now, I think we're doing pretty well, and we've got a pretty good handle on it.
That's amazing. The protocols that you're describing are the ones that we're also using in our personal lives, and it's showing it in the hospital setting how successful and important they are. So thank you very much for sharing that. If I think I have COVID-19, how would I get tested?
Well, I think there's a couple different options. If you have an established relationship with a primary care provider, that's really going to be your best route, because as primary care physicians, we are keeping a pulse on where the testing sites are open. They change from time to time depending on demand, and we will know the best place to send you that day to get tested. We can help you sort out your symptoms, determine if it meets the recommendations for testing, and then get to a testing center. If you don't have an established relationship with a primary care doctor, well, first of all, get one, because you need one. And second of all, public health has options for testing. If you are mildly ill with symptoms, that's an okay route to go. If you are really sick with symptoms, though, we want to see you in our ER. If you are really feeling pretty miserable and need some emergency level care, we really want to see you in our ER and get you tested. We can take care of you in lots of places.
Thank you, doctor. Super helpful. Maybe when our follow-up, we'll make sure that we have the public health number posted so that folks know. The 911 to get you to the hospital, everybody's familiar with, but would like to make sure that everybody who has coverage or not is aware of all of their options. What options do patients have for care at this time?
Well, the nice thing is that we have taken a little bit of advantage of this pandemic, if you will allow me that. And we've expanded our options for patients. It's really driven healthcare about 10 years ahead technologically and done so very quickly. We have options still to come in person because there's some things that you have to see, you have to examine. And so primary care providers are seeing patients in the clinic, given the safety guidelines that Chris described earlier. But we also are doing a ton of telehealth visits with our own patients. So you still get to talk to the doctor that you know and have worked with in the past, but have no contact with because it's a video visit. And these have been hugely successful. I've been doing these for a couple months now with my patients. They love them. To be able to talk about your chronic health issues or your medicine refills, things that don't actually need a hands-on approach with a doctor that knows you has been great. In case, again, you don't have that relationship, we also have telehealth options in an express care setting. And then we also have urgent cares around the area. Redmond has an urgent care if you need to get care, and Overlake has an urgent care down in Issaquah, Lower Issaquah. So both of those are options for getting care as well. We think that this provides a variety of options for people for their ongoing health needs. I do want to say for a minute, though, there is a very negative consequence to some of the changes, and that is we're seeing a spike in people having really bad outcomes from heart attacks and strokes and really serious medical conditions because they delay care. And so what I really want to say to people is we are safe and we are open, and we need to see you if you have a critical medical condition. Our ER is waiting for you. Please do not delay coming in and getting care out of fear, because you are safe here and we will take good care of you. And we don't want you to have more complications because you delayed that care. So please come to the emergency room if you are critically ill, because we need to see you there.
Great message, doctor. We'll amplify that as much as we can. I did try a teledoc appointment this week, and I had great comfort in talking to somebody who, even though it's strange, it was by video, who knew me and could, pull up my record and we could talk about things. It felt really good and comforting. Yeah. So thank you. We will do our best to amplify that message for you as well. So the recent curfew in Issaquah has been lifted, but there were nightly curfews in other areas throughout the Puget Sound as well due to protests. While many of them are maybe lifted right now, what I want to know is if a curfew is in place, can people still seek care if needed?
Yeah, absolutely they can. I mean, healthcare is an essential service. All our caregivers and providers are essential workforce members. They're coming to work. The hospital is fully functional and operational. So if it were, late after hours, they would certainly be able to hit the emergency department as the point of entry, and we'd be able to care for them no matter really what the care needs were. And during the day, as Dr. Spence has described, if it's appropriate to start with your primary care provider, they're all working here as well. really there aren't any services that we're not providing at the hospital at this time. Previously, Governor Inslee had asked all the hospitals to stop most elective procedures. That was lifted on May 18th. And since that time, we've really restarted all those services. So whether it's a previously scheduled surgery or a GI appointment or maybe a rehab appointment, all those services are back up and running now, and they're here to accommodate patients. So there's really no need to wait. And as Dr. Spence mentioned, be safe and don't be afraid to come to the hospital if you need care. We're here to serve the community, and we're ready to do so.
Thank you so much, Chris. The words elective and essential have caused a lot of grief for people in town. People who get elective surgery could be people who are in really significant pain. It sounds like such a nice, simple thing, but these are surgeries and procedures that help people who are significantly suffering right now. So I am glad to know that those are back there and that people are able to take advantage of it. Thank you. What is the one thing that you want people to be aware of during this time?
Well, I think, from the hospital's perspective is we're here to serve the community. We've been here now in the Issaquah area for about 9 years. We're steadfast in our commitment. We will be here to serve and see patients in their time of need. So, by all means, it's a safe place to come right now. I think we've instituted all the protocols that are appropriate to make it safe. So no matter what the care need, we're here to serve.
Thank you. Dr. Spence, did you have anything you wanted to share with the community?
I just agree with what Chris said. We are here for our community. We consider ourselves part of the community and servants of the community, and we are ready for you.
Thank you. We are so glad to have you in our community. I want to thank you both for joining me today. Please send my gratitude and the community's gratitude to all of your staff that is serving the community and all the work that you're doing. Thanks a lot.
Thank you.
Thank you.